Hi everyone, I'm Dr. Dave and this is Frugal Foot. Okay, well we're going to start a series on plantar fasciitis. Now what is plantar fasciitis? I mean, this has to be one of the more common diagnoses or problems, I should say, that comes into a foot doctor's office. I see several of these a day. Let's take this term apart so we better understand it. The first word is plantar. Plantar is the adjective. It means the bottom. Okay, when you look at the foot, we have the dorsum, and then we have plantar. Plantar is the bottom, so this is the bottom fascia. Now we have this word fasciitis. Now these are actually two words. We have the suffix, which is itis, which means inflammation of, and then we have this word fascia. And fascia it's like a ligament, but we cannot call this a ligament because ligaments connect bones at joints. All right? Well, the fascia runs from your heel bone to the base of your toes. Well, this is not a joint, it's a foot, so we can't call it a ligament. We call it fascia. And you have one in your hand too. There's one right there. When you pull your fingers back, it tightens up and you can kind of feel it in your palm. So that's what plantar fasciitis is from a terminology definition, but that really doesn't tell us the actual problem. So what are some of the common signs and symptoms of plantar fasciitis? Well, the most common symptoms are pain first thing in the morning. So you're in bed, you put your foot down and wham, the thing just rips and it just hurts. Okay, or it occurs after long periods of ambulation. And the pain is usually right there in the bottom of the heel, more commonly on the inside of the heel rather than the outside, although it can occur in any part of the heel. It can sometimes go into the arch. Those are some of the more common signs and symptoms. So now it is very important for you to understand that not all heel pain is plantar fasciitis. There can be other things, and it's important to see your own doctor, get an x-ray, and make certain there aren't other things like fractures or cysts or whatnot. So don't use this video just to assume that, oh, I have heel pain, it's plantar fasciitis. Oh, it follows those signs and symptoms that the doctor said, it's got to be plantar fasciitis. Not necessarily. But it is a very common problem, and those are the more common signs and symptoms for plantar fasciitis. So that's a quick definition of it. In our next video, we're going to discuss the common causes for plantar fasciitis. A very important video if you're learning about this type of problem. So if you like this video and you learned something, please give it a thumbs up. We'll see you in the next video. I'm Dr. Dave. This is Frugal Foot.